Welcome back, and thank you for staying with us as we discuss this issue of infertility in men. I've been discussing this with Dr. Kireki Omwanwa, who is a fertility expert, and Dr. David Kimani, who is a urologist. And before the break, we were just talking about some of the issues relating or causing male infertility, and at what point you should seek the help of a doctor. And for this next session, I'd like to take 1 or 2, 3 more questions from our audience here.
I had a question on alcohol and smoking. So what's the relationship between, because most Kenyans engage in those kinds of social norms?
Lifestyle changes do affect fertility. What we eat, what we use, what we drink, and so on. If we start with the smoking, in the cigarette smoke we have about 2,000 to 3,000 chemicals, and some of those chemicals actually go and affect the production of the sperm, number one. Number two, they affect the quality of the sperm we get at the end of the day. They affect the motility that we get, and so on and so forth. So what we suggest is that if we get a patient, we get a gentleman who has issues with infertility, or even if we have not really diagnosed infertility, one of the questions that we ask is whether they smoke, and if they smoke, how many cigarettes do they smoke? So our advice is, number one, either reduce the smoking drastically, or even stop. It is healthier to actually stay without those cigarettes. So cigarette smoke does affect infertility to a very big extent. When it comes to alcohol, alcohol basically what it does, when you take a few beers, you're feeling okay, you are macho and so on. But after a certain extent, you actually cannot perform as you're supposed to. I think we know of a few cases not very far from here in central Kenya, where there has been a huge cry that the men actually are not doing what they're supposed to be doing. So alcohol per se, it excites the body to a certain extent. Beyond that, there is no function at all. So we also ask whether how much alcohol you're drinking in a week, and if it is 1 beer, 2 beers, there is really no problem about it. But if you're drinking a huge amount of alcohol, then we suggest that you reduce it drastically, or you even stop.
Yes, Dr. Koril, the problem can be summed up, as Dr. Kireki says, that alcohol increases the urge and reduces on performance. That's, I think, is the bottom line. You have the urge, but you don't have the performance. Then on the other bit, chronic use of alcohol, you have influences on your liver. The liver is a very important organ when it comes to metabolism of many things, including the hormones. We know chronic alcoholism is related to lower testosterone levels. Testosterone is important for sperm production, and therefore alcohol is not good for fertility. But if it's 1 glass to get you away shy, to remove the shyness, then the doctor may prescribe one.
The lady there had a question.
Diagnosis of infertility in men most times causes the men to question their masculinity. What is the role of guilt, depression, and anxiety in the infertility? And after how long does it turn into psychogenic impotence?
That's a very important observation. If I take the issue of erectile dysfunction, we know that 95% of erectile dysfunction is psychogenic. And how we diagnose it is very simple. We ask you, do you get your morning erections? And if you do get your morning erections, then it means in the morning you are very relaxed. You have shut out all your troubles for the day. And if you wake up with an erection, then it means you have a normal function. The 5% is what we call inorganic erectile dysfunction. That's when we're now going to look into what causes it. Is it endocrine related? Is it related to blood vessels? Is it related to nerves? Yes. Once we have excluded the 95%, so that 95% of the couples, when we of the male patients who come with erectile dysfunction, we actually refer them for psychological assessment and help.
We have another question.
Earlier on, we saw that there's a large percentage of men, about 30%, who are infertile. So my question would be, is it advisable for young men before they engage or get into relationships to walk into healthcare centers and do the necessary tests, or do they have to get into their relationships and try first so that they get this diagnosis later on?
We don't know who that 30% is. Could it be somebody here? Could it be somebody there? The 30% is a general figure, meaning any Kenyan, 1 in 3 Kenyans will have an issue. The question is, should I go to check whether my fertility is okay? I think it's a reasonable thing to do. Just like, should I go to check whether I have my HIV status, which is also reasonable. If I think if I were in that age bracket, I would really consider it. Again, we saw here that age is a factor. In women as well, age is a factor. So should women also go and have themselves checked before they get 35? I think it is reasonable. So our suggestion is, if you feel that you may have an issue, or if just for your own mental ease, as it were, you can go and have yourself checked. It's a simple test. It's not a very difficult test.
That's a very good question, but I would like to correct you just slightly. It's not 30% of men who are infertile. Remember, we said it's about couples. 15% of couples meet the definition of infertility, meaning they do not get to conceive within the first year of your relationship. Now, when you now take this 15% and you analyze them, 35% the problem is in the lady, 30% is in the gentleman, and then 20% is in both, and 15% we cannot establish the cause. That said, when now it is the issue of the man, you are raising now a very moral question, as in, now that we intend to wed the coming month, should we go and have a fertility assessment? It's a very difficult question, because what is your love and engagement premised on? Is it premised on bringing out babies? That should be the first difficult question that raises. But we know physically, if you have you got to your teenage years and you found that your beard took a little bit longer to come, you found that you have 1 breast or 2 breasts enlarging as you went along. As you are taking your shower, you felt that one of the testes or both of them are actually missing. You have a duty,
or they are small,
or they are small. You have a duty to protect your wife to be, and therefore you may want to seek medical assessment before engaging. But it cannot make it. We can't make it mandatory that you must have. Remember, majority of the men who have infertility are as normal as you and I. And even when we go and do a physical examination, we will be normal. So the only way then, should we subject them to semen analysis? And I don't think it will be a good path to take.
One last question.
As Dr. mentioned earlier on, is that a man will marry 1, 2, 3, up to even the 5th wife in the search for a baby. But now, the African society blames the woman. Is there anything we are doing to make these men come out to reach these services? And another rejoinder to that question is, how affordable, available, and accessible are these services, especially in the rural areas? Thank you.
I think we are doing quite a bit, but remember, the way we are socialized is completely different. The way women are wired is completely different from the way we are wired. I see women who come to see me as patients, and they meet at the reception, and they start asking questions. What has brought you here? Where have you been? Whom have you seen? Have you had any problems? These men of ours, how many times do you have this? And they talk about some mundane things, some very, very important things, and they share. When they leave there, they are actually feeling much better. Men, we don't do that. The way we are socialized is that I am a man carries his problems, he doesn't share his problems at all. So for women, it's much easier to get help as opposed to men. For men to come to look for assistance, it takes a long time. As Dr. Kimani said here, usually they come very late, or they come when they have been pushed, and they come screaming and shouting, and they don't want to do anything with that. So I think, first of all, the thing which we must do and we must face is that men do have issues. Mbele haiko sawa, as we always think. We have issues, and we need to face these issues head on. Yes, we have infertility. Yes, we have issues. How do we as a society come out and talk about these issues without being stigmatized? So that is why, number one, I thank Mercy for bringing up this issue. It's an issue which we want to hide under the carpet. Everything is okay, but it is not okay. So talking about it, number one, is important. Number two, awareness, creating awareness, whether it is in the internet, whether it's the media, talking amongst ourselves and so on. I attended a conference some time ago, that was I think last year, and we had a similar case. Somebody from Denmark presented something very similar to what we are dealing with, that even in Denmark, which is a developed country, they don't talk about it. They tried to push them, and the men did what? The men went back into their cocoons, as it were. So I said, at least there is something that we have in common with the developed world. We don't talk about such issues. So I think talking about this, talking about it, the more we talk about it, the more people come out, the more they say, you know what, I had a problem, but there was a solution. And there are solutions. There was a solution, and this is the solution that I got, and I have a baby after that, or I have babies. So the more people come out, I think the more uncommon or less common it will be to talk about this issue. When it comes to availability, yes, these centers or laboratories where we can go and have semen checked, they are there. But sometimes the quality of the results that we get from some of these centers out there may not be very good. So I think now the onus can be or will be in the laboratories, society or clinicians, I think it's clinical officers, to sort of enhance the quality of the results that we get. Affordability, when it comes to the question of how much does it cost to do a semen analysis, it varies from laboratory to laboratory, but usually from anywhere from around 2,000 to about 6,000 Kenyan shillings, you can have semen analysis done, and the results in some labs you get them after 2 hours, some may take a few days, but they are available. Because I've got patients from Garissa, from Wajir, who've had semen analysis done, and we've looked at them. There's no problem.
I think the solution lies with what Dr. Mercy Korir is doing. One, we must congratulate her because she has brought it up as a point of discussion. Once this is aired, men will know that one, this is a problem that is shared by many, not just themselves. Yeah. Number two, that there are experts available for locally to assist those men, and perhaps challenge Dr. Korir to go even further and look for a couple that has a success story. Because if you have a couple that had a problem of infertility, they went through the treatment processes and ended up with a child, then that will even add a lot of meat to your discussion. Okay,
thank you. I think we'll look for that only if the men are willing to talk about it.
Sure.
Okay, so I think that's a nice way to wrap up this discussion, knowing that there are solutions to this problem. I don't know if you have any final comments that you'd want to make, Dr. Aris?
Yes, I think solutions are there. Again, going back to the causes, first of all, we have to find what the cause is. Once we've defined where the problem is, then it is much easier for us to get solutions to that. If the issue is issues of, let's say, for example, swollen veins, Dr. Kimani will sort that out. There's no problem. If it's the issue of the numbers and you have been on medications and the numbers are not going up, then we are here. I'm an IVF fertility specialist, and some of the solutions we have, we can get the sperm and clean it, and we can inject it into the partner's womb. We can get the sperm, we can stimulate the lady if the problem is on both sides, and we can get the eggs and fertilize the eggs. Once we have the embryos, we can transfer them into the woman, and so on and so forth. So these solutions are here. You don't have to go to South Africa or to India or the US or whatever it is. Whatever is being done out there, it is actually here. Okay. So the solutions are here, and the experts, we are the experts, and we are doing this.
Thank you.
If I may, Dr. Korir, my message would be, one, let's see that we've seen that some of these conditions date back to infancy. We have said that 3% of young boys have undecided testes, problems that can be surgically corrected. It behooves us as parents who has a male child. Can you kindly feel the scrotum of your boy and make sure that there are 2 testes in that scrotum. If not, go see a doctor. Then, as far as the availability of the service is concerned, I'm sure the government is training a lot of urologists who can sort out some of these problems, like the dilated veins. Those can be easily managed. But when it comes to high-level care, where you require very expensive laboratories, I don't think it's a challenge to our government to invest a little bit more in those laboratories, because when now the private sector put up these laboratories and they put a fee to it, then the government is again coming and saying, hey, you are charging too much. The way to assessing that and reducing that cost is not to say you are charging too much. Put 3 more that are charging less and you will be out of business. Yes.
Thank you. Thank you very much for making time to have this very important conversation, as we heard from our audience and from the feedback that we will receive. Thank you for this conversation. Dr. Kireki Omanwa, who is an obstetrician gynecologist and a fertility expert, and Dr. David Kimani, a urologist, have been our experts on these discussions, and obviously our audience who've engaged us, who've asked questions, and who have made comments on this discussion. That's where we end this show. Join us next time as we have another discussion on this series on men's health. Get in touch with us on Health Digest at standardmedia.co.ke, at Dr. Mercy Korir on Twitter, or at KTN News KE. For your comments, for your continued interaction, we'd like to hear from you. We'd also like to hear what you'd want discussed or what you would want clarified by the panelists, the experts that we've had. That's all. I wish you all a very good weekend.
November 10th, 2018. Veronica Kahunguro is at work as usual. Then she receives a phone call bearing unpleasant news.
Saturday morning, I was in office and I got a call from my house help who told me my baby has fallen, and he's, I don't know how to describe what my nanny told me, but she told me my baby is unconscious and they do not know what to do.
Ethan fell down while playing, and what his nanny didn't know was that the 3-year-old had suffered a convulsion following the fall. The seizures never stopped. Countless visits to pediatric neurologists bore no fruits. By sight, Ethan is as bubbly as any 3-year-old baby.
Yes. No.
And much as he'd love to play, Veronica is very cautious.
Only thing we can do is to keep looking after him, making sure where he goes there are no dangerous things that could harm him in case of a fall, because we do not know at what time he's going to get a seizure or where, how. We've also limited his going out to play, so most of the times he's indoors.
For any parent, taking care of a child like Ethan is difficult, but for Veronica, determination is her drive.
I just take a day at a time. Honestly, it's been very hard. I know to some extent it's affected my performance at work, but I've really tried to pull together, and the worry never goes away. So I'll just say a day at a time. There are good days, there are bad days, there are calls. There are days you get a call and you're told the boy has had 4 seizures in a day. Definitely my day will not be normal.
Burdened by hospital visits, the uncertainty of what may become of Ethan's future, whether he'll be safe when enrolled in school or the effects of the anticonvulsant drugs will fade, is a constant worry to Ethan's family. However, all is not lost, according to Veronica.
My boy loves football. When I look at him, well, aside from these other professional things like maybe medicine, probably become a pediatric neurologist and help someone else in his condition, I would also love him to become a footballer because he really loves football. And I'd want to see him maybe play some professional football.
Baby Ethan and his parents are relentless in their efforts to cure Ethan's convulsions. Hope, like a ripe fruit, hangs in the future.
Sweet, along Dr. Sweet.
No. Collins Osanya for Patient's Diary, KTN News.